What do you feel is the biggest opportunity for digital that might help actually cure some of Pharma's problems?
For me, I like to see digital lives like a train. And every month, you see new technologies coming up. And basically, when I joined Richter a few months back, I told them, we have this great opportunity to catch the next digital train. And that's actually not a problem to work hard the next couple of months or 6 months or 9 months to get there for next year or in a couple of years. And for me, this activity, which is digital or new technology, are great because you can't be a quick follower all the time. You can make a difference. And that's, I think, one of the value for this field.
So digital technology is far more mainstream than it ever has been. There's very few people who aren't heavily involved in social media, if not more deeply involved.
Yeah.
So catching the next train, I would say, is harder than it might have been at any point because there are so many people already clamoring. And the next big thing, Snapchat, WhatsApp, we obviously see these things all the time.
Yeah.
Can you identify any of those trains now?
Yeah, I would say that in the pharma industry, we do have a problem that we don't get our hands dirty. So it means between what we hear in conferences such as this one and what we need to do and understand the journey, we leave things too much to, let's say, the doers, and we don't see what are the impact of all the decisions we make. So I think if we really want to catch up and not let what I call those tech startups or the web giants taking over the pharma on the healthcare side, I think we need to understand better, let's say, the details of what means a digital activity. You mentioned social media. I think this is one of the most complex activity that a pharma can do, and we do things like lawyers, which prevent us to actually get hands-on and learning what it requires to answer, adverse event every hour on Twitter. That is not something somebody can tell you to do. Not regulatory bodies, because they don't have the background to do it. So either we take a step, in advance, try some pilots, some real pilots, not testing in tubes, but really do something that is connected somehow to everything we do in marketing and sales. And we say, okay, we really want to do social media like a conversation, not like a campaign. When you start in March and you finish in June, you really start to initiate a conversation. If you start to do that, when you have a learning curve, you create a knowledge base internally, you will do things like I would call it internally the Richter way, which is what the social media wants you to do things your own way, to be more emotional, more close to your customer, understanding the patients in every step of his journey, but your own way. So that's I think the missing point.
It's funny though, you're essentially saying we should just be natural, we should be normal. And all of the company policy is getting in the way of us doing that. Yet at the same time, even with a pilot project in pharma, we still have to be very compliant and we still have to be very careful as to what we do. So how can we create these actual physical experiments? How can we get over those hurdles, even to try new things?
If you start a project from scratch in a company and you put, like the best practice, you put all the cross functions inside the company, and you said, okay, let's put the regulatory team there, the marketing, the sales force, of course, because they are in front of the customer. The regulatory team will always come with, by the book, what you need to do by the code, and we should do that. That's important. That's preventing us to actually violate those codes. But I see and I feel we tend to explain to them the details of those activities a bit too late. And we should evolve them right from the beginning. And the past few years, I've really started to work more with those people saying, this is what we need to do, and this channel is explicitly requiring us to put more resources, to be more agile, and to do things in a total disruptive way. And they are not against it. They are not a marketing police like people like them to see them. It's rather they need to understand the boundaries of what you want to do, just double checking that you are in this code, and then they give you all the freedom to play within this code. So that's for me the missing point for these particular activities, and more those requiring a true agility. What I call agility is being able to react in 4 hours to a tweet or a Facebook message. You can't have, the way we are structured right now, you can't have 20 people worldwide taking a decision about one tweet. That is just not realistic. And we saw this morning at the conference there is this, let's say, patient-centric approach. We need to put everything around him. This is basically what I've seen in my past experience working for a group like Nestle. You take Nespresso as a company, they do everything around the consumer, or around the customer. This is, for them, they cut the boundaries of who needs to take decision and who is not required. And by doing so, creating this task force that really know what to do and when to do it and how to actually implement it. This is how you can create this agility, which is, for me, like, the essence of what we should do in the digital channel.